So my patient, Mr. Smith, is 70 inches tall and he is 60 years old. And so his goal for his IS therapy is going to be around 2,700 milliliters. So I'm going to set this little yellow tab for the goal right about there. And I have listened to Mr. Smith's breath sounds, and I've taken his respiratory rate and his heart rate, checked everything there. And so we're doing this because Mr. Smith has had abdominal surgery, and we want to treat and prevent any atelectasis. And I've explained to the patient what that is and what that means. And so I'm going to instruct Mr. Smith to exhale completely, and then he's going to put his mouth around this mouthpiece here, making a tight seal. And then as he slowly inhales, this yellow float is going to pop up. And we want to keep this in between the best and the better area. And he's going to slowly inhale as long as he can while this white float slowly rises. Again, our goal is that 2,700, but if he doesn't make it all that way, we'll work up to that. And then once he gets there, or goes as long as he can, we want him to hold his breath for about 5 to 10 seconds. A good way is usually just as long as it takes for that white float to kind of go back down. That's easier because most people forget to count. But that breath hold is the most important part of this, and so we want to make sure that they're getting that breath hold. And then I will be checking back in on Mr. Smith, making sure that his breath sounds are improving and that he's getting closer and closer to his goal.